Twice a month here on News 8 at 5:30, cardiologist Tim Malins from Rochester General Hospital joins us to talk about ways we can stay heart healthy. We call it Your Heart and You. Earlier, I talked with him about the connection to diabetes. Dr. Malins, diabetes and heart disease, most of us think these are two completely different diseases, but the causes are similar?
Very similar. You need to look at it in two ways. Is that heart disease is a symptom kind of things that can cause it, and so that being diabetes, high blood pressure, high cholesterol. Diabetes is one of the most common risk factors really for coronary disease.
So if somebody is diagnosed as a diabetic, does a physician closely watch them also for heart disease?
Exactly. They're at extremely increased risk of coronary disease. That and smoking, but with diabetes, it's a very complex kind of metabolic problem that goes on, and a lot of it's tied to our Western diet, really, and it's a problem.
What is it physically that happens to us?
So it's a problem with insulin metabolism and glucose metabolism. Insulin is essential to our bodies because we really need that to take the glucose that we eat in our diet, the carbohydrates, into our cells to give us energy. Our bodies aren't really used to having very, very high amounts of carbohydrates, and so when they get really high, what we do is the pancreas, which stimulates the insulin, has to pump out more and more insulin, and the cells have to take in more and more of the glucose that we tolerate. And I give the analogy to my patients is, if you think it from a pancreas standpoint, which has got to produce all this insulin, when we have a lot of glucose or a lot of carbohydrates and sugars, what happens is it's got to produce all of this. It's like driving down the highway in first gear at 80 miles an hour because it just doesn't have the ability to do it. And the cell's the same way. They can't tolerate all of that sugar.
Treatment similar to heart disease?
No. So what you want to do with that is you want to ensure that you're having a low carbohydrate diet. If it's severe, you need medications or even possibly insulin. And that's more down the line if you do it. But the treatment is to lose weight, lower your amount of carbohydrates or sugars, pastas, and grains to avoid that kind of overdrive for the pancreas and for the cells.
Good advice. Thank you, Dr. Malins.
Thanks, Kevin.
For more Your Heart and You segments, go to rochesterhomepage.net.